So the ones who didn't attend my lecture, you lost a lot, frankly. So I'm Prasanna Neelakantan. I'm an Indian who lives in Hong Kong. I teach at the University of Hong Kong, practice and do research. I was trained in India, and then I did my PhD from Amsterdam, and then was offered a position in Hong Kong, and I moved there about 2 years ago. This is my first time in Budapest, and I'm loving the time here. Amazing people, very high quality Congress. Very nice to be here. So the ones who didn't attend my lecture, you lost a lot, frankly. The lecture was on root canal debridement. So one of the things where I wanted to focus on the lecture was that almost everyone these days in root canal treatment speaks about company products and different instruments. What I wanted to tell the audience was that that is not the priority. Start focusing more on disinfection, because that's my research focus. All my PhD students work on that aspect, and we increasingly know that treating that infection is more important. So I was talking more to the audience about how well they could clean root canals, how they could achieve better disinfection of root canal spaces and so forth. So it was more of a combination of clinical tips along with research evidence from our own group and others. But in the crux, as an essence, the main thing was to tell the audience that instrumentation is a very small component and start focusing on disinfection. There's an increasing influence by companies and marketing of different instruments. Over the past 20 years, most of the efforts in endo have been towards designing instruments. All the money has gone to instruments. If you just walk around the trade today, you will notice that at least 70 to 80% of the booths will be selling different types of instruments, each one telling their instruments are the best. But what the audience need to know is, does it really matter? Does this brand versus this brand matter? Or is it more of the concept that should be important? Even when I give hands-on workshops or lectures to general dentists, most times their question is, which file should I use? And I tell them that it's not important. It could be anything as long as you know how to do it. Well, I have been used to a bit of Hungarian dentists even before this Congress. I know Gergi Benyus from before. We've lectured together in Dubai, and I followed his work on Facebook as well, and I know endodontic practice in Hungary is of very, very high quality. So it was very nice when Gergi had put together, and the organizing team put together, a group of people from different research interests, different clinical interests, and have a very high quality Congress. So I think it would figure in the top list of congresses for me. I would love to come back next year. I already told Gergi, if there's more research data, I told them it's going to happen next year. I'm going to come here and present again. So always happy to come back here.